Welcome back to Houston Life. You know what, your smile, it's more than just cosmetic. Yes, it's very nice to have a neat set of pearly whites to flash to the world, but what's going on inside your mouth is more important, and it's a big part of your overall health. There was a study conducted by the American Board of Periodontology that found that 49% of the US population has something called periodontal disease. And someone who knows a lot about this and the solutions available to fix it is Dr. Michel Azer from Texas Dental Implant Center, along with his patient, Donald Toney. Thank you both for being here.
Thanks for having us.
It's so good to see you. You know, you can flash your pearly whites now. I mean, they look absolutely amazing.
Thank you.
This is really fascinating. I mean, 49% of people in the United States have this periodontal disease. What is it?
So it's actually periodontal disease, and it's what we know it for in the field as the silent disease, because you can have periodontal disease, which is a disease that affects the bone and gum around the tooth, and it can go undetected for such a long time until it becomes painful. Once it's painful, it's already too late.
Wow.
So you can have your teeth, but then you notice signs of periodontal disease like bleeding around the gums, teeth are moving, bad breath. Sometimes you have some pain or discomfort when you're chewing harder food, or you feel like the food is not being chewed the right way. And so all these signs, when it happens, you need to see a periodontist. And at Texas Dental Implant Center, we're happy to see and provide a consultation for anyone who feels like they need a second opinion or need to get their teeth.
Yeah. Yeah. Is it something that you could go a little earlier and, you know, go get a checkup and say, hey, do I have early signs, or
Yes.
before you have symptoms?
Yeah, so ideally you would like to be seen by a dentist or a periodontist every 6 months. So at least you can minimize the damage before it happens, or when it happens, it's early on intervention.
But for Donald, I mean, you were quite far down the track when it came to your periodontal disease, weren't you? Yeah, I mean, how was it? What was life like for you?
Life was turning into pretty much a struggle as far as being able to speak, talk, and having the breath issue, having loose teeth, and having stomach aches, toothaches.
Stomach aches?
Yes.
Why might that be, Dr. Azer?
There is a relation to the amount of infection around teeth when it's ingested by the body. It can affect digestion, it can affect your heart, cause side effects of diabetes.
Wow.
Donald, when I saw him for the consultation, I mean, he's happy, energetic all the time. I just felt like if I can give this man a nice teeth, pearly whites like you mentioned, it's gonna transform or have his character shine more. He's even known in our practice as the dancing patient.
Really? Why is that? I want to know why that is. But look at this. Look at this before. I mean, this is what your teeth look like. And even your grandchildren were noticing some issues there.
Yeah. I tried hiding it as much as possible. You know, it was pretty much a closed mouth smile, like, so.
Wow.
Yeah.
Now, look at that. You don't have to close your mouth.
I don't have to anymore now.
But were your grandchildren noticing, like, your teeth were actually wobbling in your mouth when you talk?
Yeah, and there were times when I actually lost a couple of teeth in my sleep, and I'd wake up and that's how bad it was. It was terrible.
Wow.
Yeah, it was something I hid and I hid and I hid until, you know, there was no more hiding.
Yeah. Oh my gosh.
Yeah.
I mean, how does it feel when you are someone who's so extroverted and they're dancing? I'm going to make you dance at the end of this. How was it to have to smile with your mouth closed and you know, hide all of that?
You know, like I said, it was a hand motion where I would, you know, talk to you like this, but now I can actually talk to you like this. Not anymore.
Not anymore. Okay, so what was the solution? How did you help Donald, Dr. Azer?
So we know that the main thing that most people avoid dentists for is too many visits, too many surgical procedures, especially when the disease goes so advanced.
Yeah.
So I sat down with Donald. I told him that the right way to do this treatment is with full mouth implant reconstruction. And we're very good to get this procedure done in one day, where we can minimize the amount of visits and surgical procedures. So
that's amazing.
Yeah, Donald got one arch treatment. Basically, it's one arch for upper, one arch for lower that's supported by dental implants.
Wow.
And what it does is we're removing the source of infection, which is the teeth, replacing it with healthy implants. And from there, it's kind of pressing the reset button and then starting again brand new.
Wow. And I mean, Donald, we're seeing what the one arch procedure looks like. How is it going through that procedure?
I'd like to say painless almost. You know.
Yeah.
After he did the extractions, I went home, and the next day I came back. And
got his teeth, that first set of teeth. And one thing that I want to tell the audience also is that in 2025, we're implementing AI into our treatment planning, which is a huge thing in our field now. That means that we're designing the teeth based on the facial features of the patient. And so we're more likely to get a natural result with the teeth much faster. Even if you're someone who had no teeth to start with, we kind of know based on the algorithms how the teeth should look like, and then we design it all on computer.
Wow. And I have been to your clinic, and I've seen that you really do have some high-tech equipment there.
Yeah.
And yeah, it's amazing how you can make the teeth look so real and so, you know, look at, and it's fantastic. I mean, Donald, your teeth look so good.
Thank you.
So good. Well, this is just unbelievable. It's so wonderful that you can help Houstonians, Dr. Azer, get their smile back.
Oh, yes.
And have a real reason to dance.
Do you want to show them?
What, you want to make, he wants you to dance.
Here we go.
Here we go. We need some music, I feel.
Yeah.
You don't need music. Oh my gosh, I love it. I probably can't.
Yeah, that's where I come in the office dancing now. And I was terrified of the dentist. I was actually terrified of him. When I first met him, I was like, oh my God.
That's the thing. So many people are scared of the dentist. But you say don't be scared.
Don't be
scared. How can you? Dr. Azer, we love you.
It's such a great way to start the new year.
Yeah.
Such a great way.
Yes.
Yeah, rise and thrive for 2025.
Yes,
oh my goodness. Donald, thank you so much. Dr. Azer, thank you so much for being here.
Yeah.
And you know what? There is a special offer for Houston Life viewers. The Texas Dental Implant Center is offering the first 20 callers a free complimentary consultation, and that's after a short pre-qualification call. The consultation will include a one-on-one consultation with Dr. Azer and a 3D scan and x-rays. All of this is valued at $1,000. If you want to schedule an appointment, call 346-1-ARCH. That's 346-663-2724. You can also visit them online at bestdentalimplantshouston.com. And Houston Life will be right back with more. Yeah.